Hey everybody, welcome back. Normally when I post a video here on YouTube, I'm talking about all the reasons we can live with hope with myeloma, all the things we can do, all the ways we can meet the challenges of the treatment, all the new treatments that are coming down the pike. But today I wanted to talk about something different. A couple of days ago, a very reputable medical organization that probably many of us have seen their videos posted a video about bone marrow biopsy. And it was another video that I would call, or another message that I would call, kind of like a gaslighting by medical professionals. It was really about how you don't need sedation and how bone marrow biopsies aren't that bad. Now, needless to say, this medical professional in this video came to the conclusion most of my patients prefer to do biopsy without any sedation. And he wasn't talking, let me just be specific. He wasn't talking about the topical lidocaine. He was talking about any other kind of sedation. And underneath the video, of course, were tons of comments from patients saying this is the most painful thing I've ever been through. Some were using expletives. I mean, there was just a lot of feedback about how incorrect that was. And frankly, because this was coming from a reputable website that positions itself as an advocate for patients, it made my blood boil. I was so angry. So I've decided to start a petition that hopefully it is now July of 2025. I'm trying to aim for us to have all our signatures collected by maybe November of 2025, so it can be sent out before the ASH conference that is going to be in December. I think it's in Florida this year. It's usually the first week or so of December. It's not just going to go to the American Society of Hematology and their doctors. I'm also going to send it to the heads of the major myeloma programs and a couple of cancer institutes that really set the standards for what the standard of care should be. Because in bone marrow biopsy, there seems to be a very much a lacking in terms of the standard of care. If you want, you can just click off. I'll put a link right here in the video, and you can just click off and sign it. But if you want to hear a little bit more about it, here I go. So every year, there are about 700,000 bone marrow biopsies done in the United States. Now, this is not just myeloma. This is across other cancers as well. And as we all know, there is no standard of care. You do get lidocaine. They do topically numb you. But the issue with bone marrow biopsy is that lidocaine kind of numbs the tissue, but there is no way to numb the bone. And the pain really happens when that needle hits the bone and is sucking out the marrow and trying to get a core. You know, we also need to get a good core in that biopsy. Now, my personal story with bone marrow biopsy started way back, like in the day. Back in 1985, my older sister, who's no longer here, she had cancer for the first time. She had Hodgkin's disease. And she had to get bone marrow biopsies done in both hips at the same time. This is back in the 80s. And it was done pretty much the way they do it today. Leaned her over a table, went in, and at certain points during her treatment, she had to undergo so many painful things. I remember one doctor telling her she was a baby, 23-year-old woman bringing herself in for a procedure, and she's crying because she's in extreme pain. That was not right. So my second encounter with a bone marrow biopsy, also not for me. This was for my mom. My mom was diagnosed with multiple lymphoma in 2002. And because I was aware of what my sister had gone through in 1985, I said to my mom, well, I'm going to go with you. So there wasn't much that I could do. Basically, and some of you caregivers who are hearing this, though, I am absolutely sure you're going to have had a similar experience to what I'm about to describe. So all I could do basically was hold her hand. I crouched, by her head at the end of the table, and I held her hand. She grabbed my hand so hard and made painful noises I had never heard her make before. That was not a great bone marrow biopsy experience. When I was diagnosed, so I knew when I was diagnosed I'm having sedation. So I was in a hospital when I was diagnosed. I've got a whole video about my whole long diagnosis story. I'll put a link to that below. But I insisted when I was in the hospital. They said, we have to do a biopsy. And I said, you are going to sedate me. So in my case, they brought me down to interventional radiology, which if I had known about that, I probably would have thought about that. But I was on so much morphine and so many other drugs that I was not, I'm usually a pretty good advocate for myself, but I was not as sharp of an advocate during that whole period as normally I would be. So they brought me down to interventional radiology. I was given like a twilight sedation. I remember the whole thing though. There was this doctor who he was a student. He was originally from Egypt, but he had really studied in the UK. So he had this British accent over sort of this Egyptian thing. And it was the most pleasant accent. And I was so, on the drugs that I just remember talking about that the whole time, but I didn't feel a thing. That's the point. I remember him talking his way through the procedure, where he was visualizing what he was doing when he was pulling it out, but I felt no pain. So that was the important thing. But having interventional radiology, it means you have a radiological burden, a radiological exposure, which we don't also want that every time we have to have a bone marrow biopsy. So my next biopsy, now I'm a patient in the myeloma program at Mount Sinai, but I get my treatment locally on Long Island where I live. So I went into Mount Sinai for this. They, to me, have the optimal setup. So this is what in this petition, I'm sort of, I have written it to petition for. And I don't know if I mentioned before too, everybody will be sent to will be listed on the website, so you'll be able to see it. But I hope you will sign the petition. But the way Mount Sinai does it is they have a place called the Blavatnik Cancer Center, which is in Chelsea on 23rd Street, blah, blah, blah. And they have a PA. I'm going to give a shout out to Chad Robertson, PA, down in Mount Sinai, who did my biopsy. And Chad, basically 2 Fridays a month, the myeloma program, and I don't know if it's how their hospital exactly works, sends patients down there. And Chad is doing biopsies all day. No radiation required. There was, I don't know if it was an anesthesiologist that ran my IV and then did the little push to knock me out, but there was Chad, there was the anesthesiologist, or it could have been an NP, and then another medical tech. Don't know if it was an NP or a PA. And, it was no different than getting knocked out for a colonoscopy. This is kind of what we're looking for. Like if you just a little twilight sedation, they can give you a topical, but frankly, you probably wouldn't need it maybe. And then, no radiation, and they do the biopsy. And the fact is a PA or an NP, depending on your state, they can do these. You don't need to be in a machine. It doesn't need to even be a doctor, but it can be pain-free. So that's the petition I'm trying to start, to set a standard of care for bone marrow biopsies, not even just for us myeloma patients, but for all the cancer patients in the United States, the 700,000 biopsies that are done every year. And hey, if it really doesn't bother you, I mean, the people that I've heard say that they don't need the anesthesia and this and that, they tend to be men and they tend to be kind of tough guys. I can tell that they don't like it, but they'll tolerate it. So we have a problem when all we can say about this procedure is it's something we're anxious about, it's something we dread, it's really painful, but you get through. We can definitely it's 2025, we can definitely do better than that. And also, just as like a little side note, it's one of the points in the petition. When colonoscopies were developed in the 1960s. They didn't start sedating people until the 1970s. So there was this window of time where you would have a colonoscopy without sedation. Now, I know Katie Couric did this on TV some years ago. You can be awake for it. But obviously, the vast, vast majority of people need that sedation, would not want to go through the procedure without sedation. So I just think we can do better than the kind of callous treatment that we're getting and the way that our pain has been minimized. And especially for, again, it does apply to all cancer patients, but for us myeloma patients and some other blood cancers, we have to have repeated biopsies. I mean, this is just, it's time for the pain to stop. So anyway, I hope you will sign the petition. Leave a comment in the video if you want. And also, please pass this video around or the petition link to any other caregivers or patients. Like if you're a caregiver and you're representative of a patient, feel free to sign. And obviously, if you're a patient. Anyway, we're just going to keep living with myeloma and keep trying to improve the standard of care and get through while they improve the quality of the treatments and what they can deliver for us. Anyway, I'll see you in the next video.